Welcome back to Arthritis Now. This week we're going to be finishing up our talk with Dr. George Kalliolias at the Hospital for Special Surgery in New York. If you missed part one, be sure to check it out right here. If not, sit back and relax and let's jump right in. Where do you see your research going in the next 5 years? Do you see it evolving in any certain ways, or where do you see it kind of going?
I think that within the next few years, 5 to 10 years, I think that we will have therapeutic targets that work on synovial fibroblasts. Animal models suggest that if we block the function of synovial fibroblasts, we can dampen down aspects of rheumatoid arthritis pathogenesis.
And now, when you were funded by ANRF, you were the first ever Granger Fellow, and you actually came into our Meet the Scientists event a couple weeks ago, and you got to meet him there. How was that for you to meet him?
Actually, it's very. I am really honored being the first Granger Fellow. And it's very flattering because it's like following the footsteps of big scientists is something that really is inspiring for younger investigators, and it's like a safe route for us to go after.
That's great. Yeah, it sounds like you sound excited to kind of follow in his footsteps and kind of carry out the legacy of the research that he kind of started. And do you have an opinion on how, arthritis patients can kind of get involved and help further research? Is it donating? Is it kind of raising awareness about arthritis? What do you think about that?
Yes. Actually, first of all, I need to give you a few numbers that are very informative.
Yeah.
In the United States, we have about 1.3 million adult patients suffering from rheumatoid arthritis. So it's a big number. And that means that we need, first of all, to make any effort to make these patients feeling better. And at the same time, there are a lot of people that we can engage. So patients maybe are the best people that can be really engaged in helping with various ways research in arthritis. And one way is, of course, donating. And this has to do with their financial abilities. Not all people have the ability to donate in foundations. But the other thing is also they can volunteer in foundations like your foundation and help organizing scientific meetings between patients and scientists, patients and physicians, also informing or engaging the society in general with the concept of improving science, improving technology in order to improve our patients' quality of life. The annual cost of taking care of patients with rheumatoid arthritis, it comes in the United States around $40 billion. So it's a huge amount.
Wow.
We have 1.3 million people suffering from rheumatoid arthritis with an annual cost of $40 billion. So it's a big thing to focus on research in rheumatoid arthritis.
Those are very informative numbers, and definitely our viewers will be very interested to hear about that.
It's very important to emphasize that rheumatoid arthritis is not just a disease of the joints. Rheumatoid arthritis has also important systemic components. Patients from rheumatoid arthritis suffer from premature atherosclerosis. And this is very important because if you have premature atherosclerosis, your blood vessels become obstructed. And depending on the area that will be obstructed, maybe you get myocardial infarction, maybe you get cerebrovascular accidents. And this is one important contributor to mortality, because we know that the life expectancy in patients with rheumatoid arthritis is lower compared to the general population. And another point that I would like to emphasize is that the Last 10, 20 years, it has been obvious that development of rheumatoid arthritis and in general autoimmunity has been linked with some environmental factors. And the most important and most well described and documented is smoking. So it's very important for the patients to be informed that quitting smoking is very critical, not only for preventing cancer in the future, not only for preventing cardiovascular diseases, but also for preventing developing autoimmunity and rheumatoid arthritis.
That's interesting because a lot of people don't associate autoimmune problems with smoking, but that's great for, I think, people to know. Yeah, I think that's pretty much all that we had. You gave us a great overview of what you're working on.
It was great that I had the opportunity to talk to you and communicate with patients.
Same here, and it was great meeting you a couple weeks ago, so we look forward to seeing where your research goes, too. Thanks for watching part 2 of our interview with Dr. George Kalliolias. Don't forget to subscribe to our YouTube channel, and next month, May, is Arthritis Awareness Month, so check out curearthritis.org to find out all the ways that you can help us raise arthritis awareness.